This conference will now be recorded.
What was the last thing you heard, online doctors? What was the last thing you heard? You can write down the chat box. Yeah.
The timing of the surgery.
Yeah,
Whether the patient can have sex, about the
said,
knee replacement, elderly lady.
So did you hear about driving and sex and risks? Did you hear the risks?
No, doctor.
No.
No.
Okay, that's it. So
we
the risks
just heard
quickly.
the sex part.
What?
The last thing was the question when I would be able to have sex again.
Yes, okay. She will be able to have sex, this lady, poor lady, after 6 to 8 weeks. So that's sex and driving 6 to 8 weeks, okay? Now, I said the final point that I mentioned that you must always, when you talk about any surgery, talk about the risks. You must talk about the risk. What if the patient didn't ask? You must talk about the risks of surgery. And as I said, if you look at my knee, this is the knee. When I have knee replacement or hip replacement, anything. The risks are, number one, the skin. What is the first thing you will see here? Skin. In the skin, skin infection, skin scar, bleeding. So you would say you are at risk of bleeding, maybe, sometimes scars, not sometimes, you will have a scar and risk of infection. Under the skin, muscles, nerves, blood vessels. So there is risk of injury to the muscles and the nerves. So you may have lost some of the sensation here, okay? And then go inside the joint. So skin, muscle, and blood vessels, and joint. In the joint, there is a risk of infection, and there is a risk for the need to change the metal work or some stiffness in the knee joint. Okay, so that's the risk. So skin, muscles, and vessels, knee. In the knee, talk about the stiffness. Now, write down this scenario, another scenario, and the final scenario. Very important scenario, and I will tell you the trick about it. Yeah, 90 or 89 years old lady. Salma Hayek. Oh, Salma Hayek. 89, Salma. I'm sure that nobody wants to see her 89. You all want to see her 25, 29. You know, I put you off Salma Hayek now, yeah. But she will still be good when she's 89 because do exercise and stuff. You know, they always like. So 89 years old, Salma Hayek. Doctor, do you know Salma Hayek, doctor? She's very famous actor. Do you know her, doctor? Do you know Salma Hayek? Yeah, he knows her. Nobody knows. All males know Salma Hayek. So 89 years old. Okay, Salma Hayek. Listen carefully and write down the question, because from the question, online doctors, don't worry. The session is recorded as well, so everything is safe. So from the question said, 89, Salma Hayek presented to the hospital with a hip fracture. With what? Hip fracture. Your consultant has spoken to her about surgery. Your consultant what? Spoken to her about surgery. All right. What else? The anesthesia department, the anesthesia doctor spoke to her about anesthesia. All right. So what should I talk to her? What should I do? Go address the patient concerns and talk to her about the management. So address her concerns and relevant history and management. So do you want to talk about anesthesia? No. Do you want to explain the surgery? No. So doctors, you can hear me now, right? You can hear me. There is no audio issues now. I think you can. You can hear me now, yeah?
Yes, doctor. Perfect. Yeah.
Perfect. So the consultant has spoken about the surgery and the anesthesia doctor spoken about anesthesia, so that's not your job. And she had what? Fracture, hip, and she's gonna go for surgery. Do you understand the situation now? Okay. Can I ask you for a favor? Write down in brackets here, in brackets, PE. PE, that's all? Yeah, just write down PE. What do you mean, Dr. Mo? Write down PE. What do you mean? PE is her main concern. She is worried about developing what? Blood clot in her, in the Egyptian accent, BE. But I mean PE, pulmonary embolism, accent Egyptian BE. So write down in PE, take 3 arrows. 3, yeah? What do you mean by 3 arrows? Write down history, risk factors, management, safety netting. Again, history of what? PE. Risk factor for what? PE. Management for what? PE. Safety net for what? So guys, I made it easy now. This station, Dr. Marwa, is a PE station.
He will ask me, I'm afraid.
That's it. That's it. Yeah, that's the start. That's the start. I will tell you how the script will go, doctor. Yeah, but I'm just saying to you, it's a PE station. It is a PE station. That's it. So let's quickly, okay, give you some knowledge, some little words, keywords about PE, and then let's move on and start the scenario and finish and go home. We're gonna go home within, inshallah, 10 minutes maximum. Okay, so PE. If a patient, I will tell you after I finish the script how it will go to the station. Yeah, if a patient is worried about PE, yeah, and she said, I'm worried about PE, what is the start of the station? Why are you worried about PE? Then the patient said, because my friend, she had surgery and she developed PE. How is she? She's well, great. So now, can we have a chat in order to see how things with you? Yes. So my chat will be about history, about what is the first question? Do you know what PE is? I want to assess your knowledge. Or how much do you know? Yes, doctor, I know it's a blood clot in the heart or lung. Do you know the risk factors, the causes? No, doctor, I don't know the causes. So it's okay if we have a chat? Yes, doctor. So we will start asking here about hair. Have you ever had PE? No. Do you have any chest pain or any shortness of breath? What's chest pain and shortness of breath? PE symptom or PE presentation? No, doctor. Okay. I'm talking about hair now. Any pain in your leg? Why? Pain in the leg, in the calf muscle, not the leg, because she has a fracture. Yeah, she'll say yes, I have. You know, no, doctor. Okay. Now you will say to her, before the fracture, how was the mobility? Because it's a risk factor, mobility. Yeah, how was the mobility? Doctor, I was mobile, I was not this, that. Okay. Risk factor again for PE. Are you any blood thinners? Any? Why? Because it's risk factor, blood thinner. Any bleeding disorder? Why? Risk factor, it's a blood clot. Okay. Family history of blood clot? Yes or no? Are you on any medications? Some medications can cause PE. So now I've asked all the questions about symptoms of PE, risk factors of PE. Do you understand my approach? Why? Because her concern is PE. That's why I want to, before I tell her you are at high risk or not, I want to know first, does she have any risk factors or not? Imagine if the patient, that's why I say I hate scripts. Imagine if the patient, when you ask her, no, I have never had PE before, no chest pain, no shortness of breath, I am not on any medication, I'm fit and well, I don't have anything, my family, no problem, no PE in the family, I don't have bleeding disorder, I don't have blood thinner. But is she at high risk or low risk? Low risk. But if she said, yes, I am on blood thinner, yes, I have past history of PE, yes, family history of PE, yes, is she high risk or low risk? Guys, that's why in PLAB 2, Dr. Ahmed, you can fill a station easy if you script it. If you don't understand it, that's why when I explain the station, I explain the approach. I tell you how to approach it, and I give you the notes. You read the notes, but when you read the notes, you read it smart. Yeah, you say, okay, if the patient's taking me somewhere, I will be a bit flexible. I'm not gonna be like, no, you don't have any risk. Oh no, you are not depending. So now I've said to you, this is a PE station, and I have said to you, this lady is concerned about PE. Yeah, and I have said to you, you will take history about PE, and you will assess her knowledge about PE, and you will ask about the risk factor for PE. Taha, you know, we have a film, Egyptian film, Muhammad Hinidi, an Egyptian actor. Yes, he changed the, you know, his uniform. Taha, He didn't want people to recognize him, but every time he changed, People recognize him. This is the same. PE symptoms, PE risk factor, PE complication. Management. What is the management here? PE, because she is concerned about PE, so she will tell you, doctor, but am I at the risk of PE? Will say, well, with the type of surgery that you have in, which is going to be hip, because she's had hip fracture, you are at risk of PE. However, there are certain things that we will follow, certain protocol that we follow in order to prevent you from having PE. And from what you have told me, use the history. From what you've told me, you are at low or high? Low risk of PE, but we will take our precautions. So would you like me to talk to you about the precaution? Yes, doctor, please talk to me about precaution. Well, first of all, before the surgery, before when you are here getting ready for the surgery, because you are not mobile, we will put you on low molecular. You don't say low molecular heparin, say blood thinner. We'll put you on blood thinner before, because we don't know when she's gonna go for surgery. All right. During the operation, yes, and right after you have the surgery, we will give you what? Stocking. We'll give you what? Stocking. Why stocking, doctor? In order to compress the blood vessels in your leg and prevent you from clot. As well as we will advise you with what? Early mobility, guys. That's number one prevention is early mobility. Then giving her that stocking, and also continuing, we will give you after the surgery what? Low molecular blood thinner. So the blood thinner will be after surgery or not? Yes, after surgery. So after surgery, what are we going to do? No. Before that, early mobility. Low molecular weight heparin, which I'm gonna say to her, blood thinner. Don't say low molecular weight heparin. Say blood thinner. And after the surgery, we're gonna give her stocking. And we also have device that sometimes we use called pneumatic air compression. It is like بيزغزغك. What is بيزغزغك in English? Tickles you. No, but it's in the leg, yeah? In the cuff. Tickles. Pneumatic air compression causes some sort. It's like the blood pressure cuff, yeah? Inflate and deflate in order to increase to make the blood supply in the leg. Okay, the blood's not static. But don't explain this to her. Say to her, we'll give you blood thinner, early mobility, stocking in your leg like socks, okay, in order to prevent you having the blood clot. That's in management. Guys, let's start the script, or let's give you the dialogue, okay, and how it will go. Yes, and the last word is what we said? Safety netting. So I would like you to watch for the symptoms of PE. So if you have 1, 2, 3, 4 shortness of breath, chest pain, please let us know. Some doctors said, doctor, if she is in the hospital, why should we safety net? Guys, we safety net the patient because she will feel the symptoms before you. Before you know. So now, the station is a PE station. Okay. However, the reason why now I will tell you the script to give you some spices. Arda, black pepper, some chili spices. And the same patient, how old is she? 89. The same patient will ask, when can I have sex? Ya Hagga, when can I? 89 years old, going for major surgery. When can I have sex? She must ask you. So her concern is, when can she have sex? She's going for hip replacement. She's asking about sex. When can she have sex? Guys, 6 to 8 weeks, exactly like the knee. 6 to 8 weeks she can have sex, and you say to her, when you are pain-free. When can I drive? 6 to 8 weeks, when you are able to do the emergency stop. Okay, so 6 to 8 weeks, sex and driving. What about if she wants to go back to her normal activity and daily activity? Is what?
6 to 8 weeks.
No, 6 to 8 weeks. Every time 6 to 8 weeks. No, 3 months. Yeah, so 3 to 4 months, she will go back to full mobility and everything. 3 to 4 months. Okay. and she will ask you about, is there anything I should watch out for? Any certain movement, any?
Squatting.
Yes, squatting.
And sitting in low chairs.
Low chair. Okay, so I will tell her, guys, look at me now, because you need to look at me so you imagine it, so I'm able to explain it. Yeah, I hate memorizing. So you see me now, yeah? Look at me now. If somebody called me, I can do that, yeah? What is that? What is that? Look at this now. That's swiveling on the ball of your feet. So when she turns, you tell her, at any time you turn, please don't swivel. Swivel is like this, look. Brother, she's 89, but Salma Hayek, she can't do that. You know, so be careful. So you tell her, be careful. Okay? So when you turn slowly. Don't swivel. Swivel is like this. Yeah? Don't swivel on the ball of your feet. Number 2, when she sit down, avoid sitting on a low seat. So when she's sitting, she should be like this, not going down. So she's like 90 degree. Hip, femur, leg 90 degree, not acute angle. Understand? So always say to her, when you are sitting, please make sure you avoid being in a squatting position. So the toilet seat as well, is it low, is it high, is it, she will tell you, we can send the occupational therapist. The occupational, they will go and they'll check everything and they will make sure that your home is suitable. Okay, so when you get in a car, when she get in a car, guys, that's what's gonna happen. She should first of all sit, you see, sit, then bring your legs in. Can you see? Not, no, you will sit, you will sit first, you will what? Sit first in the seat, then you will turn your legs. So again, cross-legged, she should avoid sitting, what? Cross-legged. So again, simply, avoid sitting cross-legged. When you are turning, slowly. When you are getting in a car, sit down first, then bring your both legs in, okay? And when you are sitting in any seats, make sure it's not too low. Are you following me? 6, and driving 6 to 8 weeks. 4 range of mobility, 3 to 4 months.
And the knee replacement from 3 to 4 weeks?
No. All of them, knee and hip, are similar. 6 to 8 weeks and full range of mobility, 4 range of movement, almost 3 to 4 months. Yeah, same. We said they start mobilizing as early. Mobilizing is one thing, and full mobility is something else. Mobilizing is from day one. You ask them to move.
If she wants to play bowling?
No, guys, when she asking about exercise, you tell her you will avoid any vigorous, anything where there is what?
Friction.
Vigorous or contact, avoid. Okay? All right? So now let's give you the script as dialogue, because when I put the dialogue, I add spices. Okay? But at the end of the day, what is the station? Taha. The station is Taha, PE. History, PE. Risk factor, PE. Management, PE. Complication, PE. Safety rating, PE. Now, when you go and read any script, your life is easy. Your life is easy. Even in my notes, I made it like, guys, this is a PE station. Nothing else. Okay, so, but be careful. I hate scripts sometimes because when you look at the door and you see the question, hip replacement. Okay, and intentionally you smile at the door. Smile. Why are you smiling?
PE.
I know the station. PE. Okay. PE. Seriously, Allah, that's why people say, oh, I did everything, but I didn't pass the station. Yeah, because of this. PE is so history of PE. So you get it. How can I help you? So I'm here to help you. How can I help you? Well, doctor, I had the fracture and I'm really concerned. PE, right? You concerned about heart blood clot in the lung? Okay, all right. So you mentioned things that is not being mentioned in the question and not being mentioned from the patient. Guys, wallahi al-azim, you do big things. One of the station is written that the son is coming to talk to you about his mom. His mom had a fracture had a fracture, okay, in her hand, okay, the non-dominant hand, and she's going home on a stick, that she will use the dominant hand, okay? And then I changed it in the mock. I made it, the fracture is in the dominant hand, and she'll have a stick using the non, and everybody. I did that's so, you know, because that was a way of convincing him. She will go home, she has mental capacity, she can go home, she will have a stick in her dominant hand. The non-dominant hand is the one that's a fracture. She uses, and everybody, you know, she will use a stick with the dominant hand. And I changed in the question. You see, so in a script, when you change one word, people go tell with what they know, what they read. So avoid, yeah. So this is station. Let's start. I will go open the cubicle. Hi, I'm Dr. Faisal Dawar, one of your doctors here. Can you please confirm your full name and date of birth? She will give you full name and date of birth. I can see from my note that you fractured your hip and you are here and you'll go through surgery. Yes, doctor. Well, I'm really sorry about it. I'm sorry that you had this terrible experience. Are you in pain now? Are you all right to talk? Guys, you see how, you see, this is what, the what? The spices, because she had hip fracture. Are you in pain now? Are you all right to talk? Yeah, doctor, I'm fine, doctor. Thank you very much. I'm sorry to bring this out, but how did the fall happen? Just a 1 second question, just a rapport. How did the fall happen? Yeah, doctor, I slept, doctor. It's a mechanical fall. I slept, I tripped. You're trying to think of any eye. That's all. One question. One question. That's it. How did you? That's it. How did you have this fall? That's it, guys. It's not a full station, yeah? Well, I'm sorry, dear. I can see from my notes that the consultant has spoken to you about the surgery. Yes, doctor, he did, doctor. Do you have any concerns about the surgery? No, I'm trying to make sure that there is no about the surgery. I also can see that the anesthesia specialist has walked you through the anesthesia. Yeah, doctor, he did. She's an old woman, but so yeah, he did, doctor. Any concerns about anesthesia at all? No, doctor, it's fine. Well, now I'm here to make sure that everything is fine. Do you have any concerns? Well, yes, doctor, I'm really worried about PE. I'm worried about having a blood clot on my heart or lung. Well, that's a very valid concern. But before we go further, do you know what PE is? Yeah, doctor, it's a blood clot in the heart and lung. Ask why you are worried about it. Have you had PE before? No, doctor. It's just my friend, doctor. She had PE before. How is she doing? She's fine, doctor. She's okay now. But that's why I'm really worried, doctor. Well, yes, you are right. This is a valid concern. PE is one of the complications of such surgery that you're going to have. It is a complication. However, it's all right if you have a chat in order to establish what's happening. Yes. Have you ever developed PE before? No, doctor, I didn't. I've never, doctor. All right. Any chest pain by any chance? Any shortness of breath? No, doctor, I'm fine, doctor. I don't have any shortness of breath. What am I doing now? PE stations, PE question. By any chance, are you on any blood thinners? No, doctor. Any bleeding disorder? No, doctor, no. Okay. Are you on any medications? I'm asking about the risk factor medication. No, doctor. Anybody in the family? I'm sorry to ask you this question. I'm sorry to be intrusive. Anybody in the family has had PE before? No, doctor. Nobody. Before the fracture, how was your mobility? Are you mobile? Yes, doctor. I was before that. How is that? Very important. PE and mobility. Do you agree with me?
Yes.
Very important. PE and mobility. Okay. And beautiful if you throw psychosocial in the middle. Beautiful psychosocial, because she's gonna go home. How's things at home, my dear? How's things at home? Who do you live with? Because again, if you compare it with the new questions, it's similar. Like, you know, anybody with a fracture, you need to know mobility, you need to know psychosocial, who lives there, because they will need to be looked after later on. How's things? By the way, which hip? Yeah, we did not ask which hip, so that's in the middle. Which hip? You know. Anyway, which hip? You know. Anyway, so how's the things at home? Who do you live with? If you don't mind me asking, because this is very important for us, do you live in a flat or in a house, or okay, as a psychosocial, then you will move on. You say, well, your concern is very valid about the fact that you are worried about PE. However, from what you've told me, reassure, even though the type of surgery, okay, will increase the risk, but from what you've told me, you don't have any risk factors for developing the PE, except for the fact that you will be immobile for surgery, after surgery, and the fact that you had this fracture. However, we'll do our best to prevent this from happening. Would you like me to tell you how? How, doctor? Guys, you see, guys, how I'm maintaining all the time what? Two-way. You understand? Well, we'll put you on a medication called low molecular weight heparin, which is blood thinner. It will simply make your blood thin, so you are at less risk of having blood clot. And the main thing is we'll try to mobilize you, to make you mobile as early as we can, because the earlier you start mobilizing, the better. Because if one of the main risk factors I'm trying to make here, guys, please understand, okay? And also we'll give you a stocking. It's like a sock. It's like socks in your feet that will prevent this from happening. And then you can talk about the pneumatic air compression, but it's so, you know, like, no, enough stocking. I've never even seen it in my hospital. I've never seen it yet, and I'm an orthopedic department. So stocking, blood thinner, clear? Okay. So now you will move on to, but you know, my dear, there are things that you should watch out for. Yeah, at any time you have a chest pain after surgery or shortness, so please let us know. Any other concern? When can I have sex, doctor? I don't know. I've been talking to you about this, asking me about sex. Well, dear, that's really a valid concern. It's a valid concern. Yeah. So you will have sex. You will be able to have sex within 6 to 8 weeks after surgery when you are pain-free. Any other concern, doctor? When can I drive? Well, you can drive after 6 to 8 weeks at the same time. However, when you are able to do emergency stop without feeling pain. All right, doctor. Is there anything, doctor, that I should watch out for? Is there anything that I should avoid, doctor? Well, in this kind of situation, there are some advice we can give you. Okay, so please, as you had head fracture and as we will do replacement for the head, so always try to move slowly. What do you mean, doctor? So, for example, if you are walking and someone is calling you, so please, when you turn, don't swivel on that ball of your leg. So what do you mean, doctor? So that means that turn slowly when somebody's calling you. All right, doctor. Also, as you mentioned to me that you're driving and you were concerned about driving, when you get into the car, sit on the seat first, then brings both of your legs in. I'm sorry to be annoying. I'm gonna ask you some questions about your home. You know, your home condition. Like, do you have any low seats or low chairs or even the toilet seat? Do you think it is too low for you? Because it's one of the factors that it can cause dislocation in your hip, and we'll be worried about dislocation of the hip when she's having this. It can dislocate, comes out of the joint. So we're gonna send out occupational. You must mention here occupational. You must occupational and physio. Okay, so doctor, and when you go home, you'll be following up with us, and at the same time, the physiotherapist will follow up with you, and they will make sure that you are doing certain exercise to avoid stiffness. Is there anything else you'd like me to say? No, doctor, yes, doctor. Thank you very much. Thank you. That's it. Online doctors, thank you very much. It was a long session, I know, nearly 3 hours, and I hope you enjoyed. And it will be it is recorded. All right, I hope I started recording. Yes, it is recorded and it will be added on our drive. All right, have a lovely night, guys. Have a lovely night.
Thank you so much, Dr. Mo.
Guys, thank you very much. I enjoy having you guys on the online session online. I enjoy it. Have a lovely night.
You will add it on the drive, doctor?
Yes, that will be added on the drive, but give me some time by tomorrow. And I've added already the session for test result stations. Yeah.
Okay. Thank you.
And I've uploaded the new stations, the new recalls, October ones. Okay, as well. Thank you very much.
God bless you.